Good morning. Good morning. I am glad to see folks hopping on. We'll just give it a few moments before we get started. Thank you. Awesome. I see we're at a quorum, so I'll go ahead and get us started. Good morning. Thank you, everyone, for joining us. Free and Justice honored to have patient and physician storytellers from Georgia to put a spotlight on Trump-era Republican-led Medicaid cuts having a detrimental impact on rural communities in Georgia and across the country, forcing hospitals and critical units to close their doors. We are gathering today in light of recent news of Republicans' tax law forcing St. Mary's Sacred Heart Hospital in rural Northeast Georgia to close their labor and delivery unit. Joining us today, we have a few folks who have their stories to tell and their advocacy to uplift, including former Centers for Medicare and Medicaid Services Administrator Chiquita Brooks-LaSure. We have Assistant Professor and Obstetrician Gynecologist Dr. Laura Hart. We have rural primary care provider Dr. Karen Kinsel, and then we also have Callie Bill Harper, a storyteller based out of Savannah, Georgia. Cuts to Medicaid affect all patients' access to care, not just Medicaid beneficiaries. Republican lawmakers are fueling a nationwide healthcare crisis, and communities across the country will suffer by exacerbating existing hurdles for women and patients to access life-saving reproductive health care. Thank you all for
Can
joining
we keep
again.
it kind of quiet?
Thank you all for joining us today, and we will have time for questions after everyone shares their remarks. I will now pass the mic to Dr. Hart.
Thank you, Malachi. I really want to thank everyone for being here today. It's really an honor to get the chance to kind of speak to y'all and kind of discuss what's going on and how that is impacting us here on the ground in Georgia. Um, I think we all know Georgia is facing a very large maternal health crisis, and it's especially severe in our rural communities. Georgia has one of the worst maternal morbidity and mortality levels in the country. As I often, when I'm doing lectures to my medical students, have to say, like, we are actually worse than a lot of what you would consider third world countries around the world. That especially hits hard for our rural patients, for our patients of color. And those people already are at, a higher risk of having bad outcomes just because of their socioeconomic status, where they're located. For many of our rural communities, there is no longer any hospital-based obstetric services available. There's no physicians available. There is no labor and delivery unit. For many of these women, they have to travel 30, 60, 90 plus miles to access one of these. And for a woman having an obstetric crisis, an obstetric emergency, 30 minutes can be life or death. 60 minutes absolutely is horrendous. And so it really speaks to how we are not serving the women of Georgia. We're not serving their progeny. We're not doing anything well for these women. It also then affects the economies in these areas. They closing rural hospitals affects the economy of that entire community, because now we're affecting whether people even want to stay there to live, whether they are going to expand their families, and whether jobs are going to stay there. And it really speaks to why we need expanded Medicaid access for these patients. In the state of Georgia, more than half of women use and utilize and require Medicaid support during their pregnancies. And so without it, and with cuts to that, it only worsens the issues of them being able to access care. They forego care. They just don't get prenatal care, which causes a long list of issues. That then is also going to cause worsening infant morbidity and mortality rates here in the state. And with closing labor and delivery units, then we also have, those units are not supporting OBGYNs in the community. So you take areas that already had not enough OBGYN providers, and now there's not even an ability for an OB/GYN provider that maybe wanted to work in the area to be able to support themselves working in that area. So I think all the things that we see going on right now and the closing of the labor and delivery unit in Livonia, it affects the area I live and work in. I'm based out of Athens, Georgia. And so we really, we are going to be absorbing those patients that would normally be going to that unit. But now those patients are having to drive an extra 45 minutes, an hour and a half to get to us and to access their care. And I fear that we're just going to see, worsening morbidity and mortality with mothers and with infants. Um, we're already faced with issues in the state with our reproductive access for other services, the breadth of reproductive health care in the state, and Medicare cuts just continue to worsen it. And we've seen that when you compare us to states that expanded Medicaid, we have fewer insurers in the state. We have less access to insurance, less access to care, worse outcomes. So overall, I think we just are we're not supporting our patients, we're not supporting our communities. And I really find it so frustratingly hypocritical for a political party to say that they support families and they want women to have children, but then they do nothing that actually supports those women in having healthy pregnancies and having good outcomes. And it's why I continue to fight. It's why patients sometimes, ask like, why do you stay in Georgia? Why are you here? Being a doctor. And I said, because I need to be here and I want to fight, because if I just leave, I mean, I have the privilege, I could just leave, I could just go somewhere else, but that doesn't fix the problem. And I think that we can fix the problem. I think that we can do great things. I think we can do hard things. But closing units because they're not economically viable also speaks to, and I mean, I could talk about this for hours and I'm not going to, I promise, but traditionally obstetrics and gynecology, obstetrics is not a money-making part of the hospital. It's a money loser. But we know that women drive healthcare for their families. So when a woman has a good experience in an obstetric unit and she has a good outcome and she loves the nurses there and she likes her provider and, oh, the hospital was pretty and it looked great and, all these things, when her husband needs a procedure done, when her father needs his heart cath done, she'll say, "Oh, you need to go to X hospital because I had our baby there and it was just wonderful." And we know that that's the case. And so, no, we don't make tons of money for the hospital on the front end, but long term we do. But I think it also just speaks to how a lot of times women's healthcare has always been put on the back burner. So, again, I could ramble on about this for days, but I'm gonna go ahead and I will turn this over and let someone else have a chance to speak. But again, I really appreciate being here. Very passionate about this. Many ideas in my head that I could, go on and on for how we could fix this. But thank you.
Thank you, Dr. Hart. I'm going to pass the mic over to Callie Bill Harper from Savannah.
Thank you, and thank you all for being here today. My name is Callie Beal Harper. I am an artist that also holds a degree in child and family development from the University of Georgia. And I'm a mom to my son Isaac, who is almost 6, and my daughter Kit, who will be 2 years old in less than a week. So I'm here to share a story that I quite honestly never thought would be mine. Oh, sorry. Okay, can you hear? Okay. Everything okay? Can you hear me? I can't hear you. Okay, I think it's working. So I had years of infertility, and so I was absolutely thrilled when I found out that I was pregnant in April of 2023. And come to find out, it was twins. And my husband and I were so excited to welcome more children into our family. But at 12 weeks, that joy was shattered when I found out that one of my babies had a severe chromosomal and structural anomalies. I was living in a rural part of Georgia at the time, and was about 30 minutes from the closest hospital to me. Um, so I went to a doctor in Atlanta, and that doctor told me that continuing to carry both twins threatened the development and survival of my healthy twin and also put me at risk for premature delivery, premature rupture of membranes, which would put me at a high risk for sepsis, a deadly infection. And I was absolutely gutted. My doctor told me that I needed a procedure called a selective reduction, a procedure that would reduce the number of fetuses in my twin pregnancy as soon as possible. He kept saying that over and over, as soon as possible, get this done. As soon as possible, get this done. Every passing day would be an increased risk to both my healthy twin and myself. But then he told me that I would have to seek care outside of the state of Georgia because of Georgia's restrictive law tied his hands. Um, it, so the specialist advised that I make 3 appointments in 3 different states and only cancel the other 2 after I successfully completed this procedure because he knew that time was of the essence and it would be really difficult to get the care that I needed in a timely manner. So I first looked at North Carolina, but their laws changed within that time, and it ended up being a wait of 4 weeks. And I had to leave the country or leave the state of Georgia and go to New York City for this procedure that, quite honestly, I would have never chosen, and only did because I desperately love my daughter and I wanted what was best for her. So my husband was working across the country a good bit at the time, and I waited those 4 weeks, and it was quite devastating. And so I had to struggle to book appointments and logistics and financial and logistical burdens. Do you book an Airbnb with a 5 floor walk up after a procedure like this? And so I did all of that and came back to the state of Georgia while I was grieving, and I was completely broken. So I could not get that appointment until I was nearly 17 weeks. That was a 4-week delay in the care that I knew that I needed. And sure enough, everything that my doctor told me would happen did. And again, I was living about 30 minutes from the closest hospital to me at the time. I woke up in the middle of the night covered in amniotic fluid and blood, and I was contracting. My husband carried me to the car as well as my 3-year-old son. And all 3 of us terrified. We had to drive 30 minutes to the hospital. And I remember how painful every single one of those 30 minutes were. I screamed and begged for someone to help me and my healthy baby because they wouldn't let me beyond the ER for quite some time. They said they had to put me on a plan in line with my outcome, whatever that meant. So because I screamed and made a scene for someone to help me, I was moved up to labor and delivery, where I learned that I had a retained placenta from the twin that I lost and that I was indeed becoming septic. My levels eventually leveled out, thank goodness, because they were going to have to then induce me for my completely healthy baby because pregnancy was killing. But I was admitted 10 times in 10 weeks after that as well for various problems. And since my husband was working out of town, I was even unable to lift my son. I had to go stay an hour and a half away at my mom's house in rural Alabama. And there were several occasions in which I had to drive myself bleeding, leaking amniotic fluid over an hour to seek care. And I remember one of these nights, it was storming really badly, and I was already terrified and traumatized. But I mean, just even facing normal things like a bad storm, while, it was something that I would never wish on anyone. Um, because of my delay in care, my daughter was born at 27 weeks. It was a very precipitous delivery. And at this point, we had moved to Savannah, where I am like a mile from my hospital. So, really, it was interesting that I got to see the difference in being 30 minutes from my hospital and right down the road. And thank God I did live here during the second half of my pregnancy, because they were just checking my routine heart tones and my baby's heart rate when she quite literally just came. And she would not have been able to survive at 27 weeks without the 30 people that were right down the hall, that the respiratory therapist, the NICU team, that came in and took over quite skillfully. And because of my delay in care in her early delivery, she had a brain bleed, retinopathy of prematurity, which affected her eyes, and a lung disorder. So then we got 3 months in the NICU after that. So I can't tell you how thankful I am for the care providers that I had at both hospitals. And it was very evident to me that they absolutely loved what they were doing, and their heart broke as much as mine did about circumstances going on. And I've since reached out to many of them actually, and just asked more about what it looks like to be a provider in these times. And it's heartbreaking. So I recently learned of the closing of this hospital in North Georgia, and it's devastating. Um, I know how vulnerable it can feel to be pregnant, even with a healthy, wanted pregnancy. Anxiety is common. Knowing that my doctor was nearby if I had a question or a problem was so important to me as a patient. And when I had to wait a month for care and started going septic from being denied care and being forced to travel on top of an already impossible situation, it was devastating. I am so thankful that I had the means to travel out of the comfort of my home city and my support team and my family that was helping me care for my son, to receive the care that I needed to save my life. But many people in low income rural areas do not have these means. And now, with the closure of the labor and delivery unit at St. Mary's Sacred Heart Hospital, this will leave so many pregnant women with little to no options for safe and accessible reproductive care. Women will now have to travel over an hour outside of their homes just for regular checkups while pregnant. Georgia is already a state with one of the strictest abortion bans in the United States. And now St. Mary's is shutting down its labor and delivery unit due to the $1 trillion Medicaid cut that Donald Trump championed and every Georgia Republican supported. I know the dangers of not being able to receive care, but especially the dangers of not being close to care. And the difference can and will mean life and death for mother and her child. This hospital closure is one of the first Georgia-based casualties of the Republican tax law, but unfortunately, we know that it will not be the last. The closure of this hospital means that many women now face the same impossible choices, the same terrifying dangers that I faced and that my family faced as well. This closure is a direct result of policies that leave women behind. We must do better. And we have to ensure that every woman in Georgia and beyond has access to safe, timely, and compassionate healthcare. And now I'll pass it over to Dr. Karen Kinsel.
Thank you so much, Callie. I was not aware of your story, and it's heartbreaking. And all of our thoughts go out to you, and I'm so glad your daughter and you got through this.
Thank you.
I wasn't planning on bringing this up, but there's something called moral injury that the Physicians for National Health program are researching now, which has to do not only with the patient suffering with inexcusable restrictions on the practice of medicine, which is what we're facing in this state right now, but the injury that that does to the healthcare providers. Your OB who told you, look, you got to get out of this state and get appropriate healthcare now, now. That hurts that provider. And kind of makes you question life choices, certainly, but it hurts because we know that people die when they don't have access to things that we paid a lot of money for and know damn well that they need, and are so sorry when, we know the actual people who are going through this. So, thank you for that. I work in rural Clay County in Southwest Georgia. I've been the only provider here, or was the only provider here for many years. And so I know how difficult it is to provide basic health care in rural areas. We've already lived what Livonia is going to see. The whole time I've been here, it's been an hour to the closest labor and delivery in Georgia. Um, and the problem isn't just births by the side of the road or in the ambulance. It's what happens when women can't make their prenatal appointments, which is pretty frequent. If by the time you get transportation 2 or 3 counties over and try to make that appointment, it's not been that unusual where the OB contacts me and asks me, well, can you check, some basic labs to make sure this lady's okay because she couldn't make her appointment today. I'm an internist. I've birthed 2 babies in my life. I should not be involved in prenatal care. Um, and as an internist, I know that what makes healthy babies are healthy pregnant women, and what makes healthy pregnant women are healthy women. And women must be healthy before they get pregnant. And that means that they must not have uncontrolled diabetes or uncontrolled high blood pressure. Georgia never expanded Medicaid like the majority of the nation did, like 40 states did. So I see many people who don't have insurance, who don't access what limited care we have for their diabetes, for their high blood pressure, even for family planning. And even those who qualified for marketplace plans over the years, they had low paying jobs, so they qualified for marketplace plans. Many of them will lose that coverage at the end of this year due to the subsidies running out at the end of this year. And I don't think most people really understand what is ahead on that. And there needs to be much greater education on that. Heck, a lot of people are going to lose insurance at the end of this year. And this is all because of you can call it the BBB, I call it the bad bullshit bill. It's cutting the funds for Medicaid for rural areas, for marketplace plans. And there's what a $50 billion set aside to cure rural healthcare in some way, that we're supposed to cooperate better, and that would fix all the problems. And I'm telling you, cooperation and the internet, that's all great. We're all for that. But you can't deliver a baby over the internet. And if women can't afford to get basic health care, there will be more sickness, more death among women, pregnant women, and babies. And this in a state that already has one of the highest maternal mortality rates in the country, actually in the world. And people have a hard time wrapping their head around that. But I practice in Clay County. There's 1,000 people in my town, 3,000 in the county. I know women who've died perinatal deaths in such a small population. If we, the government, the community, truly care that life is important, then we need to ensure that access to reproductive health care, all health care, is not only legally available, but also financially available. And we need to act on that. And we need to act before this bad bullshit bill comes to full fruition. But again, Kelly, thank you so much. And again, our hearts are with you. I will turn this over to Dr. Brooks-LaSure, who was the former, you'll have to tell us. Thank you.
Let me really just start by thanking you, Callie, for sharing your personal story, which was so moving. And let me also just say how glad I am that you and your daughter are okay. I
Thank
will
you.
say the most heartbreaking part of my job as the former CMS administrator was talking to women like you who had had these horrific experiences because of our change in laws across this country. And I really want to say also to you, Dr. Kinzel, and you, Dr. Hart, just how hard I know. I think you talked about just how heartbreaking it's been for you as providers to be in this space. And I also have talked to so many providers over the last couple of years and certainly in the last couple of months about what a challenging time this has been, many of whom have actually left OBGYN services because it's been too heartbreaking. And just really thank you for your service to your communities and to the women who have been in your care. And I really want to say how well you all have outlined just some of the real impact on people and communities that the last couple of policy changes have made on the day-to-day interactions of so many. I want to thank you, Free and Just, for organizing this session. And I'm really grateful to be able to give maybe a big picture look at what you all have illustrated in very direct terms about what this will mean to rural communities. As a result of this law that congressional Republicans have passed and President Trump signed into law, there are 16 million people who are at risk for losing their coverage through Medicaid and Affordable Care Act coverage in the private sector. And as we're hearing, there already were issues across our country at the beginning of this year when we had high levels of coverage. If anything, we had work to do to make coverage better. But now we have taken $1 trillion out of the healthcare system over the next 10 years. In Georgia, 2.2 million children and adults rely on Medicaid. The cuts that have been passed would leave hundreds of thousands of Georgians without coverage, slash up to $10 billion in Medicaid funding over the next decade, and force impossible choices for families who already live on the edge. For 24 million Americans nationwide, including 1.5 million Georgians who have Affordable Care Act coverage through Georgia Access, marketplace premiums will increase by hundreds or even thousands of dollars more this fall due to Republicans ending valuable tax credit subsidies. For those of us who get coverage through our employer or who are enrolled in Medicare, we are also at risk of facing higher premium costs as well. As we know, this can be the difference between families being able to pay their rent, pay for their mortgage, or having to decide whether they're going to pay their car payment or for prescriptions this month. People across the United States and Georgia are already seeing the warning signs from the Republican tax law. There are over 300 rural hospitals that are estimated to be at risk of closing. It really was devastating to hear that St. Mary's Sacred Heart Hospital is shutting down its labor and delivery unit as a result of the cuts of the Republican tax law. You've heard directly about just the impact of the difference it makes to be 30 minutes versus 1 mile from your hospital. It really does make a huge difference in terms of any kind of care that you're getting in an emergency. But certainly as a mom myself, I know how nerve-wracking it can be, even if your child and your pregnancy is a relatively healthy one. Nobody wants to worry that they are going to be delivering their baby on the side of the road. Callie, just listening to you trying to drive in pain I can't even imagine just what was going through your head, and it's a miracle that you got there. Okay. St. Mary's isn't the only rural hospital that's at risk of closure. 20 of the state's 71 rural hospitals could close due to Medicaid cuts, with estimated losses amounting to over $500 million over the next 10 years. We are seeing this trend across the country. Just earlier this month, 3 rural clinics in my state, Virginia, have announced closure from this law. And earlier this year, a rural clinic in Nebraska announced its closure as well. This law harms all of us, but this crisis is not inevitable. It is a choice. Republicans in Washington are choosing to side with a handful of billionaires and big corporations instead of protecting the health care that families rely on. People across this country and Georgia deserve a healthcare system that is both affordable and accessible. These midterms could be pivotal in reversing the effects of the Republican tax law on Medicaid. We must fight back against the harm that the Republican tax law poses to our nation before too many people across this country, especially in rural America, lose access to their health care. Thank you. And with that, I'll turn it back to Michaela.
Thank you so much, everyone, for taking the time to be here. And again, Callie, thank you so much for sharing your story. And thank you to Dr. Hart and Dr. Kinsel for just being the public servants that you are in the capacities as medical professionals. And CMS Administrator Chiquita, thank you so much for being here. I did get a few questions in the chat, but I also want to open the floor if reporters want me to unmute them or anything like that. So I'm going to ask the first questions that I've received, and then I will move on. I have a question asking, Dr. Kinsel, do you have an estimate yet of how many of your patients lose healthcare coverage as a result of ACA subsidy expirations?
I don't keep numbers on anything, but I do know that before the ACA, we had about a third of our patients were uninsured and we would see them anyway. And now we're down to 10 or 15%. So I'm assuming it's close to 20% of my patients are likely to, and you know, people, $20 increase for somebody who's making $13 an hour is going to cause them to drop their insurance plan. And so even though the actual dollar amounts are much higher for higher income people, there are going to be a ton of people who are going to get this bill at the end of the year, along with their tax bill, and just say, you know, screw this, and are going to drop it. And I would expect in my practice, it's at least 20%. And in that, of course, that impacts the hospitals also. We had a big one of the big lumber industry plants closed near here also, so that lost 500 well-insured jobs, and so they would be normally looking for the marketplace, and they're unemployed now, and they're going to look at that and go like, no way. And I think I worry that that's going to be the last straw for the struggling hospital in that county, just to the south of us.
If I can chime in as well too, I would say I agree. I think ours is probably going to be about 20-25% of patients, but also we know that when those subsidies fall off, and then those patients are not going to be able to afford, so they will become now uninsured. We know that even private insurance rates are going to go back up. They're going to increase because they know that they are going to be taking care of a larger load, and those hospitals are going to be requesting higher reimbursement rates to care for patients that don't have insurance. So it's really a domino effect of it affects this group of people directly and horrifically, but then it also is going to affect everybody downstream, just because of all those things. Whereas back to if we distribute, across, if we had expanded Medicaid and we distribute those risks across, we can kind of take the economics and make it hurt a little less to everybody. And I think we're going to see how bad it is. And I don't think people understand how bad it's going to be until it happens.
And to add to that, when hospitals close, providers leave. We've seen that in all of our surround. We've lost 3 hospitals within 50 miles in the last 10, 15 years. And there's not the money there to support them staying. And so they leave. And so everybody loses out. There's no one for the bank president to see. There's nothing. And as difficult as it is culturally to attract providers to these rural areas, when you can't pay them, it makes it really, really rough.
Thank you so much. And I actually think this is a good segue into the next question that was sent in to me directly, which was if folks can elaborate on how expensive maternal health and reproductive health care can be, and how not only the increase in cost will impact access to care for situations like Callie, but also for physicians and providers to provide care. Anybody can jump in, but
So So, for patients who don't have insurance right now, so really there's the way that obstetric care is managed, and again, this is a really long conversation, so I'm going to try to give you guys like the super short version of it. Um, we we do not bill for each individual visit the same way that you would bill for a patient coming in for like a problem visit or an annual exam or anything like that. Maternity care is billed in what we call a global fee. So we don't get paid for any of the care that we provide for a patient until after they deliver and we see them postpartum. And then we get whatever the insurance company has said, okay, here's how much you're going to get. For patients who are self-pay, we have basically looked at like, okay, in my private practice, we kind of base it off of, okay, what would Medicaid reimburse us for this care? And we kind of bill kind of about the same that we would get from Medicaid for that. Because it's like the least amount that we get of all the insurers. And we sometimes even cut that down even more for patients when we know that there's an issue. And then we break it up into, chunks, monthly payments, or I've had patients, we negotiate, okay, you're gonna pay me $10 a week when you get paid and go through. The issue is not so much on my end, the issue is the hospital side, because the cost for me, self-pay cost to me runs probably, I'm going to just say on average, maybe around $2,000 for that entirety of care. The hospital side of things, what they are quoted generally is around $25,000 for delivery. They then can get a discount through some of the hospitals for that. Sometimes certain hospital systems, and I've worked for a few of them across the state of Georgia, will come to the patient and say, okay, if you can pay today, right now, we will discount it 50% or, 75%, but you got to pay it today, right now, all of that. That's still, a significant amount of money to come up with all at one time for a patient. And if that patient can't pay it all at once, they'll say, okay, well, you don't get a discount, but we'll give you a payment plan. Well, $25,000 is a significant amount of money to pay off over a period of time. And so for a lot of patients, those financial aspects, when they start looking at that, I have had patients who they wait. They were in a position where they're still on a payment plan for the first baby. They put off having another baby because even though they want another baby, they put it off because they're still paying off the first baby. And so it's very expensive to have a child in this country for a lot of different reasons. That's a whole nother discussion. But it is only going to be worsened by patients not having access to any kind of insurance that can help supplement that and support on that. Pre-ACA, insurance companies didn't have to support maternity care. They didn't have to provide coverage for that. And I think we're going to see a lot of insurance companies going back to that, where, yeah, they'll cover you for seeing your internist, but they're not going to cover maternity care at all. And patients are going to be back paying out of pocket for that.
thank you so, so much. I'll open the floor in case anybody else wants to talk about it, but otherwise, anybody else in attendance can also send in any last questions before we wrap. Seeing none, thank you all so much for being here today. This was absolutely phenomenal. It's so great to hear from all of you from Georgia, and I think at the end of the day, this conversation doesn't end here. And we look forward to, continuing to uplift the stories of women like Callie and uplifting the voices and expertise of people like our doctors and our CMS administrators, because this is what's, important today. And I'm glad that we were able to host this space today. So thank you so much. Folks, reporters, we will send out a post event release afterwards so you can look for any recaps of today's event. Thank you so much.